So the question of can a poor uterine lining cause a miscarriage is a very interesting one. So the endometrial cavity, which is inside the uterus, is measured on ultrasound as the endometrial lining. And as long as there are no polyps or fibroids or scar tissue from prior miscarriages or surgeries, or even retained products of conception from a prior miscarriage or a delivery, as long as those things are not present in the uterine lining, a patient should have a normal uterine lining in terms of uniformity and thickness. But now and then we see patients with thinner uterine linings, which can be from causes like scar tissue or prior surgeries, or it can just be a patient with a thin lining. And a lot of times we tend to fixate on these things, and they may or may not be as important as we think they are. I think the main thing is to make sure that there's nothing causing the thin lining. And as long as there's not, then it's a matter of a pregnancy happening in that lining, as long as there's receptors in the endometrium that can accommodate an embryo. So the short answer is a thin uterine lining should not necessarily be causing miscarriages, as long as there are no other problems or any other pathologies associated with it.